To intervene is to enter into an ongoing system of relationships for the purpose of helping others. There are three important points to stress about this definition. An intervention enters into the ordinary stream of organizational life and is influenced by all of the complexities inherent in organizations, such as politics, goals, and history. Because they often try to unsettle current practices, interventions can be uncomfortable enough that people may resist the intervention. The objective of interventions is to help improve the effectiveness of organizations, groups, teams, and individuals. Interventions consist of two interrelated activities. First, action planning, or devising the appropriate intervention strategy to address the organization's problems, and second, implementing the chosen intervention. An intervention can be as small as a single meeting, event, or workshop, or it can be a series of events that help a group or organization change in progressive steps. An intervention strategy may consist of a number of different events, where consultants propose strategic planning, executive team building, and cultural change intervention. Each may be adapted depending on the client or circumstance. Interventions may function differently in different organizations, so flexibility in the application of any intervention is a necessary skill for the change agent. Depending on the organization, what has worked for one group may not work for another. Organizational change interventions are implemented in a challenging environment. Many organizations choose to implement fad programs such as total quality management, empowerment, or re-engineering programs only to see them result in little or no change, and then they give up on the program. Interventions fail to achieve their desired objectives and result in lasting organizational change for a number of reasons, including the following. Consultants who follow a client's definition of the problem may conduct an intervention resulting in little or no change because the client had a limited view of the problem and the consultant failed to investigate further. The wrong intervention was selected. Goals were ambiguous, unclear, or too lofty. The intervention was undertaken as an event rather than as a program of activities with multiple targets for change. Not enough time was devoted to the change. The intervention was poorly designed to reach specific goals. The change agent was not skilled in implementing the intervention. Responsibility for the change was not transferred to the client. Organizational members resisted or were not committed to the intervention. Last, it's important to be reminded that what counts as a failed intervention is a matter of perspective. The cost of a failed intervention can be much higher than simply the time wasted on implementing it. The consequences to the change agent include not only losing the current client engagement, but developing a poor professional reputation and losing other potential clients. In the organization, change attempts may be delayed until every possible factor is taken into consideration to defend against all possible points of failure. Participants may experience an increase in frustration and cynicism. Some of these effects may be visible in an organization. For organization members, in this situation, failure becomes a cycle, a self-fulfilling prophecy that members feel doomed to hopelessly repeat. A positive outcome is also an option, and fortunately, success can also become a cycle. As the pattern is broken, organizational members relearn what success feels and looks like, and they are increasingly able to make it happen again. The significance of selecting the right intervention strategy and managing it well cannot be understated. Regardless of which intervention is chosen, it's important to be cautious of why and how the strategy is intended to work. Effective and long-term change is also most likely when the intervention is well structured for success. The structure of intervention activities and how organizational development practitioners plan and facilitate them relies heavily on the foundational values in which OD is based. The first is an empirical rational approach, in which change is accomplished by persuading people that a change is necessary, providing data to support the argument, and justifying the need for change. A second approach they term normative reductive, which is based on the notion that change will occur when people change their attitudes, values, skills, and relationships, and when group norms encourage new behavior. A third strategy is defined as power coercive approach, based on policy, law, economic incentives or punishment, guilt, and embarrassment. OD interventions are structured to create opportunities for learning, give free choice to participate, and present clear outcomes. Everything about an intervention should be consistently directed towards outcomes. Unfortunately, the objectives of the intervention and its design are often in conflict. The most flagrant violation of this practice occurs when, for example, a group wanting to engage in more effective collaboration is forced to sit through an 1 hour lecture from a leader on how to engage in collaboration. Instead, if collaboration is the goal, participants should be given the opportunity to practice it from the start. The point is that the design of the session should model what's expected out of it. If the change is the goal, then each meeting has the opportunity to reinforce it through the structure of the meeting agenda. The intervention stage presents the change agent and client with another opportunity to negotiate roles. Some consultants take on highly involving roles in which they essentially become surrogate managers, whereas others may choose to substantially decrease involvement after their recommendations are made. Among the roles that change agents take on in an intervention are the following, each of which can vary in the change agent's involvement. Helping a client or group attain its desired outcomes by clarifying alternatives, processes, and decisions. Acting as a boundary spanner between groups or between a supervisor and team, negotiating between them and giving objective feedback. Pointing out what has been seen, heard, or learned to enhance group or individual awareness. Designing situations, events, and conversations so that awareness, learning, and change can occur. Advocating for a particular approach or perspective. Eventually, responsibility for sustaining the change will need to be transferred to the client. The action planning and intervention stages represent arguably the highest susceptibility for ethical conflict. It's important to note that for many OD practitioners, selecting the right intervention rises to the status of an ethical issue. Other ethical challenges include the following. Consultants may be tempted to misrepresent time, cost, or difficulty of an intervention to please a client or to overpromise that a given intervention will achieve certain outcomes. When the type of intervention necessary is one in which the consultant has no experience, it's their responsibility to admit to not having conducted such an intervention. A common example of collusion occurs when a consultant agrees to implement an intervention even in the absence of data to support its use. Participants may not know the purpose or the intervention may not be structured for genuine choice to participate. Intervention techniques differ along many dimensions. We can differentiate interventions by their target audience and consider them to exist in three broad categories: those that apply to individuals, groups and teams, and whole organizations. It's not possible to cover all adaptations of the universe of organizational development interventions that have been created since the field's inceptions, so we discuss those that are most commonly used today. Some of these interventions can be adapted to more than one target area, such as those used for both teams and organizations.